Hello, dear student. Welcome back to the discussion of subject pharmacy practice. In that, we are today will be discussing the last point of your syllabus, interpretation of clinical laboratory tests. That is the C point of the fifth unit. Interpretation of what? Clinical laboratory tests. Now, clinical laboratory is nothing but the laboratory where different tests were carried out to diagnose different diseases, the condition of different parameters of the patient were analyzed by means of conducting various chemical tests, and you should be able to, you means at least the pharmacist or the physician should be able to interpret what the result indicate, result of the test. Interpretation means understanding, or we can say explanation, or a reading of the results or the uh, test results, what we will get after these tests. Okay, the pathological laboratory, which are also called as clinical laboratories, where these different tests were conducted. So about the different tests we have to study in this case, which are related to the blood, that is hematological parameters, as well as the urine analysis. Okay, and also we have to study the blood chemistry in this topic. So simple topic, many of the point generally discuss or study under the HAP, human anatomy and physiology. Okay, this subject. Now let us move to its introductory part. Human body consists of many subsystems. Okay, subsystems means different organs which maintains the internal environment of the body. Okay, within the physiological limits. Now the limits, within the limits, those all chemicals, okay, might be in the form of various ingredients or constituents of blood. Okay, or might be your hormones, which are responsible for controlling many of these. Okay, the glands which secretes such chemicals. So these all are present in the human body to have the control or maintain the overall physiology of the physiology means the working, regular working of the human body and its organs. Sorry, if these limits of all physiological materials are changed, the damage may indicate the existence of some or other ailments or disease in the patient or in the body. Okay, definitely, if there is any alteration in the uh, limits, okay, if within less than the noted value, or might be more than the noted value, what we can say, the specific material in the body is imbalanced, and it is due to the some kind of disease which is related to that particular substance in the body. So that has to be checked. So for what the physiological parameters are there which help in the diagnosis of that specific disease, okay, in this clinical practice. So by conducting various chemical tests we can come to know where is the problem. Chemical test means different diagnostic parameters or clinical evaluations which were done. The clinical laboratory test results are very important parameters where for diagnosis, monitoring and screening. Okay, you will be only able to find out what sort of problem is there in the body by that particular disease, okay, or which disease is there which can be only diagnosed by these various tests which were conducted, okay. And further, by its monitoring means you have to perform these tests might be more times initially when there are problems, that is symptoms arises in the patient. Okay, the doctor asks the patient to go for checking the blood or urine, that is blood analysis, urine analysis, they were done. Okay, for what they will be able to diagnose what is the problem, okay, after the result if got properly, okay. And after that they initiate or start the treatment after specific time, okay. They again retest the same samples means the same tests were conducted by getting another specimen, okay, might be blood or urine of the patient, means what, it is monitored again whether the improvement in the physiology of the patient is there or not, which can only be understood by observing the uh, results of these clinical tests which were conducted, okay. And uh, they should be generally within the limits, okay, if it is the treatment is on the correct way, okay. 70 to 80% of the decisions in the diagnosis are based on the laboratory results, and more laboratory results are requested, okay. Nowadays many physicians, okay, maximum of those were needing these diagnosis the test done, okay. Earlier some experienced doctors were there, okay. I'm aware with the one doctor in my city, uh, that doctor never asked for any diagnosis these tests, because he is having years of experience, and by only the symptoms he can manage to know what is the problem, what is the disease, okay, and the accurate treatment is given. But nowadays, okay, definitely due to the advancement of these all technologies, we should go for these tests, okay, to just have the precise diagnosis of the problem, okay, in the patient. And definitely more analysis were requested, okay. See, the word over here used is requested, not compulsorily should be done, because not always they are needed. If the doctor or physician is sufficiently experienced or intelligent, they directly go for treatment of the patient, okay. The laboratory results must be interpreted on the background of a reference interval, that is the standard value, okay, which is used for distinguishing the two conditions healthy condition and diseased condition of the patient. Okay, how the results obtained, whatever data the observation is got, it is needed to be compared with the standard, which is called as reference range or interval. Okay, because the within limits, if it is the observation, means we can say the patient is healthy. Okay, while definitely the uh, out of range, if it is there, the person is having certain problem. Okay, like disease is there. Okay, see, in this case again, the diagnosis of a disease is many times based on the information obtained through the laboratory data. The laboratory test abnormalities are values which are outside the normal range for specific people, and if the true abnormalities are found, okay, these are responsible and are generally associated with the sign and symptoms of the patient, okay, of that particular disease in that patient, and the abnormal values may be caused due to the disease, okay, or might be the problems which the drugs which have administered by the patient as a side effect, it might be there. So the goal of any disease treatment are generally focused on modifying the underlying disease process, okay, importantly, rather than on changing the laboratory test values. Okay, there are many tests steps are there, okay, which are involved in the laboratory test. We know, starting from the collection of the sample, okay, might be blood, urine, then evaluation, means actual the practical procedure. Okay, nowadays all sophisticated machineries were available in which you have to simply put the sample, okay, and you will get the result in the form of print. So that is this another step, and reporting the laboratory data. So these all many steps may result in an uh, increased chance of error, and that error can be avoided by sometimes repetition. Okay, and if you are doing it precisely, no way of getting a problem. But even sometimes the problem is arises because if you conduct the same test in one laboratory, okay, you will get some different result, and in another laboratory it may be different because many problems are there. Okay, like a change in machinery, the change in method, change in the person by who is conducting the test. So some errors are there, they can be there. Okay, clinician, that is the person who is going to conduct or diagnose the disease, they must also evaluate the results from the knowledge of biological variations and be aware of the potential risk of false interpretation. Very important thing. Okay, they should not go for directly analyzing, okay, or going to the conclusion without proper interpretation. Because if there is a problem in that interpretation of the got results of these different tastes, okay, the patient may be in danger. Okay, so they should be having the proper understanding of the risk associated with such tastes, and it should be precisely interpreted. Similarly, influence of random error and systematic error on the results is of importance, as well as the diagnostic sensitivity and specificity. Okay, you should be avoiding such errors which may be occurring while conducting the testing. Okay, because the diagnostic tests are very sensitive. Okay, the samples you provide, they should be analyzed by exact method. Okay, again the range what you are mentioning, it should be correct one. And if you are counting it, counting by means sometimes the we know where CBC, that is complete blood count, where it is done. So what you have to do, counting. Okay, like RBC or erythrocyte, where you are counting means you are actually counting the number of cells. So manually if it is done, it may result in variation or error. But if you are using modern equipments or machinery, okay, the problem will be avoided. So that sensitivity and specificity is related with that. Okay, laboratory has certainly also a role and responsibility in providing clinicians with adequate information that can assist them in the correct interpretation of the data. Okay, definitely the results obtained, okay, by conducting all the tests, they are very much important. And they assist the doctors. Okay, they give sufficient proof, okay, that what problem is there in the patient, and so that the diagnosis will be exact, and accordingly the treatment will be initiated on the patient. Okay, now about the lab results. Okay, lab results sometimes may be positive, sometimes may be negative or inconclusive. These three possibilities are there whenever you are conducting different tests. Okay, clinical test or pathological test on the samples. Now positive test results means the substance or the condition being tested was found in the patient. Positive test results also can mean that the amount of a substance being tested for is higher or normal. Okay, higher or lower than the regular or normal range. Okay, if it is outside the limit or outside the range, means the test result said to be positive. The substance or the material for which you are conducting the test, okay, if the concentration or the amount or even the size of the material, okay, depending upon test, are more or less than normal, means what we can say, the result is positive test. Okay, and whereas negative test means what, if the substance or the condition of the patient which is being tested, okay, was not found, means what, the substance is present in normal amount, means within the range, okay, within the given limits of the particular substance, and ultimately the physiological condition of the patient said to be normal, and the taste is said to be negative taste. Its results are called as negative test results. So that is two options first of all. Okay, whenever you are conducting the tests. And rarely, okay, another possibility is also there called as inconclusive tests. Okay, these results are also there, which are those results, okay, that are not clearly positive. Okay, we cannot say exactly that they are negative, but even they are not clearly positive. For example, some tests measure the level of antibodies to some bacteria or virus in the blood, okay, or the other fluids to look for the infection. If you are measuring the level of antibodies, okay, we cannot say exactly those antibodies level has been raised due to bacterial infection or viral infection. Okay, we cannot exactly say it can be viral or bacterial infection, but this is the knowledge of again the clinician or the physician is tested over here, means he has to judge properly with its experience. It is not always clear if the level of antibodies is high enough to indicate the infection. Okay, that is also some many times possible. Okay, not always clear the level of such material. Okay, importantly the antibodies, they can several time might be lesser means within the range, but the patient is suffering from the problems, means the symptoms are there. Okay, but antibody actually should be arised, rise, they should be increased in number because of the infection in the body. But when you conduct the test and you find that the antibodies are in normal level, so what we can say, okay, we will say that the test results are inconclusive results. Conclusion is not there whether it is positive or negative, okay, because the symptoms are there and your test result shows antibodies are in range. Yeah, that is only example. Similarly, in different tests, the problem can be not surely interpreted at that time. Such results are called as inconclusive test results. Okay. Now, false positive. Okay, you might have heard this terminologies in this COVID condition. Okay, Corona, COVID-19. Okay, false positive results. Many patients got such test results if they have conducted, even though they are not having symptoms of the disease, they are found to be positive for this COVID. What is that? Okay, let us understand this terminology. A false positive test result is the results which shows a disease or a condition present when it is not actually present. Okay, we have seen what is positive means it is there, the problem is there, but false means the condition is not there, means the problem is uh, got in the result, means in the result of in the diagnosis they are showing the problem is there, but there are not any symptoms. We know when the disease is there it will show symptoms, but if there are no symptoms means that disease is not there. Okay, while the test is positive, so at that time such results are called as false positive test results. These false positive test results may be advised, okay, or they says that the person has a disease or a condition, but actually that patient is not having it originally. Okay, the patient is not having any disease. Test result says that the person is deceased. We'll take a simple example. Actually, COVID-19 is a better example for that. Okay, just I told, if we know what are the symptoms generally, the frequent high fever, okay, then sometimes shivering, cough, okay, and uh, not easiness to breathe. Okay, so these are said to be the initial symptoms of that COVID-19. And if all these are absent, and if you are going for testing, okay, for corona, and it shows positive results, so at that time that result can be called as false positive results. Okay, similarly for this, another example we'll take for the pregnancy diagnostic kits are there. Okay, they generally shows that pregnancy is there, means fall a positive test will be there. Okay, but actually the woman is not pregnant. Okay, means originally that woman is not there, but when the urine of that woman is tested for that pregnancy test, okay, the test shows positive result, but she knows that she is not pregnant, means what we can say, the result of that analysis are false positive test results. Okay, similarly false negative test results are also there. Okay, okay, opposite condition, that means as per these results, the test does not detect whether the test the disease is there, but the disease is actually there. Again, we'll take the same example of COVID-19. Okay, the patient is suffering from cough, cold, fever, improper breathing. Okay, and if that person is tested for uh, COVID, means the person is if actually infected with that virus. Okay, and when done the testing, if the test is found negative, at that time we can say it is a false negative test. Okay, the result suggests that the person does not have the disease, but actually the patient does have the diseases. Okay, you can also take the example of the pregnancy itself. Okay, a false negative pregnancy result would be one that does not detect the substance that confirms the pregnancy, but actually the woman is pregnant. Okay, when the test is done, it will show negative result, means as per the test the pregnancy is absent. Okay, but actually the woman is pregnant. So what we can say about this condition, it is a false negative test has been there. Okay, which is a problematic condition, definitely. Okay, like a false positive results. Is it like it is likely that result is different than the reference range or the standard range, even though nothing is wrong with the patient or with the person? Yes, this is possible. Several times this is there. Your the results obtained for that particular uh, disease, if you have done, okay, or some regular testing is done, okay, that we will show variation in the ranges, but actually you are not having the problem with you. So there are certain reasons, okay, for uh, getting such results. Yeah, see, some reasons are mentioned over here: due to the pregnancy, okay, We know during the pregnancy many hormonal changes are there in the body of woman, and at that time if you go for testing some uh, clinical conditions, at that time okay we may get variation in the ranges of the results. Another option, if the patient is under administration of some other medicines, okay, the drugs which are taken by the patient earlier, okay, due to that there are chances the test results may vary, okay, might be less than the range or might be exceeding the range. Another reason, eating just before a test, okay, generally this is happening with the patients who are conducting the test for diabetes, okay. You know, if generally what it is suggested, twice the test should be done. Twice means in the same day, fasting and after meal. Fasting means without eating anything. Early in the morning the test should be done, and after the lunch, okay, again after 2 hours of lunch, another second test should be done. Okay, so this is what suggesting you should not eat just before the test, and if you are doing it, the test result may vary. Okay, then smoking, another reason which is also a problematic condition, so we should avoid. Okay, and if you are under tension, if the patient is stress, okay, at that condition also the results may vary, but actually the disease is not there. So it is also happening with the diabetic patient. Okay, if they are not actually diabetic, but if they are under huge tension, they may show elevated level of sugar level, okay, in the bloods. So these are uh, about different tests analysis. Okay, other thing about the topic we'll be discussing in our next lecture. Thank you.